I'm doing this a regenerative treatment to have a better quality of life. I played football for most of my life, 9 years professionally, another 4 years in college, another 4 years of high school, another 3 or 4 years as a kid in Little League. So over time, those hits, they're cumulative and it takes its toll on your body. And now that I'm getting older, I still want to enjoy my life. I still enjoy working out. I still enjoy playing ball. I still enjoy doing active things. And I want to feel good doing that.
Rich Steinfeld, I've been an orthopedic surgeon here in Vero Beach for 19 years, and it's now my pleasure to be associated with RBI and the technologies they have to offer you, our patients, newer options to help you heal and regenerate your tissues and to lead a more active life. As an orthopedic surgeon, I see a tremendous number of complaints related to joint pain, body pain, aches and pains. People who work out, people who are very active. We have a limited number of non-operative options that we could typically offer people. For instance, the use of medications or therapy or injections or bracing. RBI has a very comprehensive program in the ability to use the body's own tissues to hopefully act in a reparative and regenerative process to help your body heal itself. So in other words, people who may have inflamed rotator cuff tissues in their shoulders that have been unresponsive to the normal measures we use, this gives an individual another option to help control that disease process.
Yeah, after I had this is my second time coming here. This one for my shoulder. This is my first time doing my shoulder, just getting a touch up on my knees. And immediately afterwards, within a matter of days for me, it felt like I can go out and carry the ball again. You know, I've got my competitive edge back without having to go under the knife under a surgeon. And that's the number one thing for me.
And so our goal at RBI is to minimize inflammation, minimize morbidity, keep people out of the hospital and make them functional and healthy for their entire life. And we use science to do that.
So an individual who may be told, listen, your only other option now is to consider replacing your joint, now has another option that might offer them pain relief, but enable them to keep their own natural joint for a longer period of time. And that's a very, very important thing.
And I came here to RBI because, number one, they're very extremely knowledgeable about what their work is. They're explaining to you exactly what they're doing, why they're doing it. Very thorough with their approach. They make you feel comfortable with the process. The process is not long at all. You come in and out. It's nothing, no bells and whistles, and it's one of the best in the country, in my opinion. I can't speak for anybody else, but in terms of what they do, how they do it, and how they explain it to you, it is top notch and one of the best.